You know, if you live with chronic joint pain, you understand it's so much more than just a simple ache. It's often this feeling of instability, a lack of trust in your own body. And it can be so frustrating when you feel like you've tried everything and nothing seems to give you that solid foundation back. Today, we're going to explore a really fascinating approach, one that's been around for decades, that aims to rebuild that very foundation, right from the inside out. Let's dive in.
Does that sound familiar? Have you ever felt that? You know, like a knee that you're worried might just give way, or a lower back that feels loose and unsupported no matter how strong the muscles around it are? It's a very specific and, honestly, a pretty unnerving sensation. And this metaphor, it hits the nail on the head, doesn't it? The bones themselves, the tabletop and the leg, they're perfectly fine. But the connectors, the little bits that are supposed to hold it all tightly together, have become lax. Well, in our bodies, those connectors are our ligaments and our tendons. And when they get stretched out or injured and just don't heal up properly, they can't provide that stability a joint so desperately needs.
So, how do you go about fixing that wobbly connection? Well, the method we're talking about today, it sounds a little backwards at first. It's a therapy that suggests we can heal by causing a very, very controlled and targeted irritation. Let's unpack how that could possibly work.
This is Prolotherapy, and it's also known as regenerative injection therapy. The name itself actually comes from the word proliferative, which means to grow or to create something new. So the entire goal here is to kickstart a natural, proliferative healing process right at the source of the weakness. And I know what you're thinking. That's the million-dollar question, right? It sounds like you're fighting fire with fire, but the science behind it is actually really quite elegant. It's not about causing damage, it's about sending a very specific signal.
I love this metaphor. The solution that's injected, and you'll be surprised, it's most commonly a simple hyperosmolar dextrose. And what that really is essentially a concentrated sugar water. This simple solution acts as that wake-up call. It creates a mild, very localized inflammation that basically tells your body, hey, we need some attention over here. Send in the repair crew.
And this is that healing cascade in action. The inflammation is like a signal flare. It attracts your body's own growth factors and these amazing cells called fibroblasts. Think of them as your body's tiny cellular construction workers. These fibroblasts get right to work laying down brand new collagen, which is the key building block of all our connective tissues. And over time, this new collagen matures, making the ligament thicker, stronger, and just better at its job of stabilizing the joint.
So that's the beautiful idea behind it. But you're probably wondering, what does this actually look like in practice? What does it feel like? Well, it isn't a one-and-done procedure. It's more like a structured journey of healing.
The whole process is very methodical. It always starts with a really thorough diagnosis to pinpoint the exact ligaments or tendons that are causing that instability. Then you have the injection session itself, which is followed by a super important healing period. And finally, there's a series of follow-up sessions to build on all the progress that's been made.
And this is a really key point to understand. Natural tissue regeneration it takes time. You can think of each session as another call to that repair crew, reinforcing the work they've already done. The spacing between treatments allows each cycle of inflammation and repair to fully complete before the next one begins.
The precision here is absolutely critical. Practitioners are targeting the exact points where the ligaments and tendons attach to the bone. These are known as the Fibro-Osseous junctions. So it's not just a general injection into the joint space. It's a series of small, very specific injections right at the source of that structural weakness.
After a session, the care is really all about protecting that healing process. And you'll notice that last point. You're asked to avoid anti-inflammatory medications like ibuprofen. And you might wonder why. Well, because that mild inflammation is exactly what we're trying to create. It's the engine of this whole repair process, and the last thing we want to do is shut it down. Now, that brings us to, I think, the most important question of all. What does the research actually say about this? As with a lot of regenerative therapies, the body of evidence is always growing and evolving, so it's really important to look at it with a clear and balanced perspective. So, what we have here is balance. On one hand, we know prolotherapy has been used for a very long time. We have biopsies that show increased collagen and those active little fibroblast repair cells after treatment, and animal studies have shown it can create ligaments that are measurably thicker and stronger. On the other hand, science is still working to fully map out all the complex mechanisms at play and to standardize the absolute best protocols. This is a really key finding. It comes from a major Cochrane review, which is one of the highest standards we have in evidence-based medicine. And the big takeaway is that prolotherapy isn't really seen as a magic bullet all on its own, but as a potentially powerful part of a comprehensive treatment plan, one that also includes other therapies like exercise and manual therapy.
And just to put some numbers to this, one randomized study looking at sacroiliac joint pain, or SI joint pain, found a pretty significant difference. As you can see, at the 15-month mark, almost 59% of the patients who received prolotherapy reported a positive outcome. Now compare that to just over 10% in the group that received the more common steroid injections.
Okay, so with all of this information on the table, who is this for? And just as importantly, who is it not for? Understanding where prolotherapy actually fits in the whole landscape of pain management is really key. While this therapy is typically considered for people who have chronic pain, where that ligament or tendon laxity is the suspected culprit, that wobbly table leg we talked about, it's often for common problem areas like the low back or the knee, and usually after other treatments like physical therapy just haven't been quite enough on their own. And of course, it's not a fit for every single situation. A qualified practitioner would always rule out any contraindications, things like systemic inflammatory conditions, certain spinal issues, or bleeding disorders, long before ever considering this as an option.
So the final thought here is this. Prolotherapy really offers a different way of thinking about healing. Instead of just masking pain or trying to reduce all inflammation, it's trying to rebuild the underlying structure by harnessing the body's own innate wisdom. It's a fascinating concept, and it left us with a really compelling question to consider for the future of regenerative medicine.